Simple awareness doesn't get anyone excited. However, corporate reputation, that gets people talking. I've been doing this work for the last 10 years. And as I dive into report after report with different organizations, yes, the advocacy team wants to understand their awareness. What's the view of the advocacy function? How about their programs and how they're coming alongside of advocacy organizations in the field to support them? May that be any of the 12 different advocacy function tactics that we measure. Think about disease awareness and education as one. The advocacy leadership loves that. But when it comes to moving the needle with corporate, that's all about corporate reputation. And corporate reputation is an important metric, but it's not the only metric. It's the reason that we at ARCO have been constantly evaluating and changing our survey to live up to the needs of the changing marketplace. At the end of the day, what's not being measured doesn't get the budget. So why not get a better understanding of where your teams should be, where your customers in patient advocacy, professional societies, and community-based organizations expect you to be, and your performance there. Now, I'll give you a little tidbit. If you're doing those things right, your corporate reputation score is going to look good. Now, we know that senior leaders love that corporate reputation metric, but here's another secret for you. The biggest leading indicator of a corporate reputation score and where it's going year over year, because we've talked about this before, any year's report data from Elevate is a simple snapshot in time. We have to track those metrics year over year. However, what I will say is that the one measurement that has shown time and time again to lead us to what those outcomes will be in the future is how much is your senior leadership engaged with the community? How much are they coming out of their quote unquote ivory towers and getting out into the patient community to understand the needs of patients? If your senior leadership is not taking a day, at least one day out of every quarter, to go to an industry conference or to get out into the field with the patient advocacy team and hear directly from patients, caregivers, parents, you name it, then that corporate reputation isn't moving anywhere. Now, this is the glory and the benefit of our Elevate report is that we're able to measure both. We're able to understand not only those elements that senior leadership wants to get a better understanding of, and if we're moving the needle for the overall perception of the organization in time, but we're also able to gather insights that are important for our patient support teams, important insights on HEOR and utilization of healthcare outcomes research for those folks. We're able to understand for our medical teams and regulatory who are designing clinical trials, we're able to understand patient-involved medicine development or patient-focused medicine development. A very important feature that as we look at has become more and more of a desire from patient advocates year over year. So we're not only just tackling leadership desires, we're not just tackling, again, those advocacy elements, but also for about 6 other teams within your organization, including your policy team, your health equity team, if you have one that might be folded under your corporate communications function. We're able to tackle with one study key insights on what the community in patient advocacy organizations, professional societies, and community-based organizations find important. That one study can provide not only the inputs that you're looking for, but it can also allow you as a patient advocacy leader the opportunity to connect and break down silos within your organization. We see it time and time again. You in patient advocacy have amazing insights and work hard each day with the patient community to understand their needs, their challenges, the barriers they're facing in getting access to a product, maybe not even your product, and the barriers they're still trying to overcome, especially political ones. You have the pulse of your community, but at the end of the day, are we able to do anything about it? And a lot of the times that comes down to us being able to gain entry into other parts of our organization that don't know they're needed. I'll give you an example. one med tech company that we worked with was really focused hard on gaining access and correct formulary placement for their products for the Medicare Part B beneficiaries. Is this right for this patient population? Well, not only did they think it was right, the patients felt it was the right solution for them. You have to understand, in the world of continuous glucose monitoring, that is a solution that is truly second to none in innovation in diabetes. You're telling me that I can track my glucose and my current insulin rate without having to prick my finger hourly or at least multiple times a day? That's what the patients wanted, and that's what we were looking to help this particular company do. Now, when we looked at all of the data and we looked at what the needs were the ability for that organization to come alongside of the patient advocacy organizations on key policy initiatives, not just at the federal level, but we have to remember at the state level as well. State formularies can look different. Different plans for Medicare and managed Medicare at the state level will have different levels that they'll place that product. So it was all about how can we not only understand where we're at now in working on those key policy issues, but also what do we need to do to look better and move the needle on this key issue for both the company and the patient. And by utilizing the Elevate data, not only were they able to understand that they were a lagger on policy education and making sure that folks in the community, like the patient advocacy organizations and community-based organizations, were aware of when the government was asking for input or when there were opportunities to provide patient stories, success stories, failures, faults, so on and so forth, that speak to the reality patients face. Those elements all came to light in the data, and we were able to help that company and help that advocacy and policy team break down the barriers and connect, especially in this case, policy and advocacy. And how impactful and powerful is that when you have patients and patient advocates who understand the challenges that patients face, can prepare those patients to go in and speak on their own behalf and reference their stories to humans. We have to remember, the folks in DC and the folks at your state capitol are humans at the end of the day. And a good story goes a long way. So by bringing in the Elevate data, we're able to take down that wall that was in place between policy and advocacy, allow them to take that data, to share it and understand, now what can we do with it? Where can we, of those 7 different metrics that we track in policy, where can we take action and get better? Where can we take specific action on this particular Medicare Part B issue? And also, who are the right organizations that have the pulse of the patient that we can go to together to tackle this issue? It was ultimately a grand success for them that resulted in hundreds of thousands of patients getting access to a product that previously had required them to go through multiple step edits and prior authorizations to gain access to. But all by starting with the facts, by starting with the data, they were able to move the needle and get the benefit for their company and the patients. And again, if we come back to the awareness component, it was of course about understanding the awareness for the company and were they seen as a leader? At that point, they weren't. Now, but by tackling this strong need in a policy-based area, they were able to show the community that their voice mattered, that we as a company care, and we saw them not only jump up in the awareness of the activities on both a programmatic support and a policy support domain measurement, and we were able to see those scores move up. They went from 7th place overall in the diabetes space to 2nd, teetering on 1st. And we're talking about a small med tech company, not a big pharma company with multi-million-dollar budgets. All of it done because they showed that they cared, they used that data and got after it. And of course, as you might expect, that corporate reputation score went through the roof because the transparency and the trust that was built was done so with the patient in mind first. So if you're still thinking about the fact that, hey, advocacy data, who needs it? Well, let me tell you, you're sitting back. If you still think that advocacy data is only going to tell you about awareness of patients to the different programs you're running, let me tell you, you're missing a massive opportunity to take action with data that will tell you the story of exactly where your organization needs to go, what leadership needs to do, what different teams need to do in partnership with advocacy, and ultimately, you're sitting back, missing out on your own success.